Okay, so here's the thing. You can have a disc herniation without sciatica. I've seen it many times. People have an MRI on their lower back. They have a herniation at L1, L2, L3, L4, L5, FS1, whatever it is. You can have that without sciatica. Seen it plenty of times, undeniably true. I have seen some really messed up MRIs, and when I see that information, I'm like, ooh, they have a herniation at multiple levels. I asked the patient in front of me, hey, Mrs. Jones, are you in pain? And she's like, no, I feel fine. And I'm like, okay, so you have a herniation without sciatica, and if you have that, that is absolutely nothing to be concerned about. Just go about and live your life. Don't get hung up on the things that they see on an image. You will waste so much time and money doing that, so don't get hung up on that. So you can have a herniation without sciatica, but can you have sciatica without a herniation? So sciatica typically is caused from a herniation in the lower back, especially in younger individuals. The other aspect of sciatica could be most likely caused from stenosis, a space issue, normally in older individuals. And so you usually have those two things causing sciatica, either herniation or stenosis. But more than likely, if you're younger, 50 and below, you're most likely having some of that sciatica due to a disc herniation. But I have seen it too, where they go and get an MRI done because they're having sciatica and they don't have a disc herniation at all, and when they're younger. And so you may be leaning more towards piriformis, or you may be leaning more towards something else. But that's the relationship between a herniation and sciatica. Herniation without sciatica can absolutely happen. Sciatica without a herniation can happen, but a little bit more rare. So with the video today, I'm going to tell you exactly what I tell my patients, what I say to them during our treatment and our evaluation and what I look for, and you're going to be able to use those things and apply them to you. Now, there's a lot of nuances there, and as we go through the video, I'm going to tell you those nuances because it's important, and one little difference can make the whole pathway different for your treatment. And so if we don't diagnose it correctly, if we don't know the right things in the very beginning, it can skew everything down the road. So it's important to pay attention and apply those things to you. And if you have any questions, make sure you leave them underneath the video. Like, it's important to get those questions answered because it can make a big difference in your treatment. So first we're going to talk about disc herniations. Let's review the anatomy really quick because I think it's important to understand the anatomy because it can reduce your fear a little bit around a disc herniation. I know it sounds scary, but let me review this with you. So you have stages of a disc herniation. So the first stage being a disc bulge. And so the disc bulge is just, you have a little bit of that inside material kind of bulging through the annulus, the nucleus pulposus, mostly water, and it's kind of pushing towards the outer edge, but you have no pressure on the nerve root, you have no serious thing going on, and on the inside of the annulus, it's often not even innervated. So most of the time, and I say most of the time because anybody over the age of 30 is going to have disc bulges, you don't have any symptoms related to this. So no one cares what they have until they start having pain. And so no symptoms usually associated with the disc bulge. And if they do have symptoms, it's mild and you're definitely not going to have sciatica, but it is, somewhat common to have a disc bulge. Okay, so herniation time. So the disc herniation is when that annulus becomes really thin on the very edge, most of the time back and off to the side, because that disc material, the nucleus pulposus, is starting to push towards that outer edge, and you're going to potentially have symptoms with this. And so it is not uncommon to have no symptoms, but it is also common to have some symptoms related to this, and it may just be back pain and glute pain, but you could have symptoms down the leg as well. And so some of that nucleus pulposus is starting to exit that disc and push towards that nerve root, potentially giving you some symptoms. Now, as I'm going to continue reviewing the other stages related to this, you may notice that, hey, I've had an MRI before. It's told me I had a disc herniation. That's why I'm watching this video. And I think it's important to understand the true anatomy around it, that you may or may not have symptoms. And that herniation may have been there for a long time. We just don't know. And that's why it's really important to bring up the caveat of whatever they see on the image needs to be correlated with your clinical signs and symptoms. So it needs to match what you're feeling, what they see on the image, because it's important to not go chasing your tail treating an image when you may not actually be feeling those symptoms at all. And so it's important to know the disc herniation is just one stage of it, but you could start to have symptoms with that. And the last two stages are the sequestration and the protrusion. And that means that stuff in the nucleus pulposus, including the outer edge of the annulus, things have just been moved from where they should be to the nerve root and exiting towards the spinal canal and just the area of the spine where it should not be at all. that's when you start having some more symptoms, and that's when I notice that, hey, this person is really having a lot of leg pain. They may have foot drops, some weakness in their leg that they're not even picking up on. Severe symptoms is because that disc material should not be in that area. Like, that is not a normal place for it to be. And so it's not to be taken lightly because it can be very uncomfortable. But with that said, I've seen patients from both of these areas recover very well with conservative care, but it is a little bit of a trek to get there. And so it's important to review the stages because I wanted to give you just a little bit of education before we go over the things that I look for in my patients, be like, okay, this person has a herniation. Okay, so don't get hung up on all of the stages that we just reviewed. It's not important to really be like, okay, which stage of the herniation am I in? That really doesn't matter. We can still diagnose it even if you are not perfectly fitting in one of those stages, because you could have a mix and you may have started with a sequestration, but now it's more of a disc bulge. We just don't know. And sometimes you have an incidental finding in that. I've had patients get an MRI of their pelvis or their hip and they're like, hey, they found these herniations in my back. Like, oh, do I have a disc herniation? And so then we start reviewing those questions. But I'm going to tell you the 3 things that I look for in patients that if they're like, hey, I think I have a disc herniation, prove me wrong. And so the first thing is that you're younger, right? So most likely disc herniations are happening in people who are younger, 30s, 40s, 20s, and there's usually an incident associated with it. And so if we look at the occurrences of disc herniations, the younger you are, the more likely you are to have it. L4, L5, L5S1 are the most common areas. And if you're younger, you're more likely to have a disc herniation. The other symptom that I'm looking for is radicular pain. And so remember those stages we went through, and the disc material starts to push on that nerve root. And if you're having symptoms that are more like sharp, stabbing, burning discomfort into the leg, calf, or foot, I'm like, ooh, like, yeah, if you're younger and you're having that, I'm really leaning towards a disc herniation. And so those 2 things themselves, I'm like, ooh, I'm really starting to think disc herniation. But then the last caveat related to that is the image. And so a disc herniation itself can be symptom-free. So we cannot rely on just symptoms for disc herniation. A true disc herniation can only be diagnosed from an image, and that image is typically an MRI. And what you see on the MRI is that you see that disc material starts pushing towards the spinal nerve root, just like I spoke to earlier, and that is going to be classified as a disc herniation. Now, I will say I've had plenty of patients have a disc herniation on their MRI and no symptoms at all. I've also had patients have leg pain and be younger but not have a conclusive disc herniation on an MRI. There's a lot of variability there. We're not 100% accurate. And so we rely on the clinical exam plus the image if we need the image to help make an accurate diagnosis. And so younger, radicular pain, and you have an image to prove a disc herniation, I would consider those symptoms to be correlated with a disc herniation. And so sometimes with a disc herniation, you will have sciatica, sometimes you will not, and sometimes, you know, sciatica can be completely independent. But I want to go over the things that I look for in my patients. I'm like, oh, you don't have a disc herniation, you have sciatica. Okay, so now that we've went over the main points related to a disc herniation, let's transition to sciatica. And so sciatica can be gnarly because it is very uncomfortable. But what's interesting about sciatica is that most of the time that my patients report to me that they're having pain, it is not in their back. And so that's a big distinction in that you don't have to have back pain with sciatica. In fact, it's really not something that I'm looking for. And when you're looking at the diagnostic criteria for sciatica, back pain typically is not on there. So that's an interesting thing to take away, is that your back pain may be independent of the sciatica and may not be related at all. And so when we're talking about sciatica, sciatica is a clinical diagnosis. So remember when I mentioned the MRI for back pain, now we're talking about sciatica, which does not rely on an MRI, and you don't have to have any type of imaging to diagnose sciatica. But you do need 3 things for sciatica. And sciatica has to include numbness and tingling in the leg or foot. And what I mean by that is if you're looking at sciatica, it includes the lower nerve roots of your back, L4, L5, L5S1, and those nerve roots correlate with the leg and foot. And so if you have true sciatica, has to do with the sciatic nerve, and if you have any type of impairment in that, I would expect numbness and tingling or sensation changes in the leg. I would also expect weakness. Weakness would be in the leg and foot as well. You can't lift your toe up, you can't lift your ankle up, you can't do a calf raise. I have a great video going over some of that stuff, but in to be more clear about this is that the sciatica in regards to sensation changes and weakness, both of those things require a strong clinical exam. And so you may be good at picking up the sensation changes, but the weakness can be harder to pick up. And if those two things are there, you're going to be leaning more towards sciatica. Now, the last part of sciatica has to include some sort of pain down the leg. And so when we're talking about the sciatic nerve, remember that refers down in the lower leg, and I would expect you to have some pain or symptoms in the lower leg when we're talking about sciatica. So we got lower leg pain, we've got sensation changes, and we have weakness. And so those things, if you have those things that you've either been told you have those things or you may be feeling some of those things, I would be leaning more towards sciatica. The next thing that we need to talk about is the relationship between sciatica and disc herniations. So here's what I tell my patients when they're in front of me and we're trying to figure out sciatica or disc herniation. Okay, I'm like, Mrs. Jones, I believe that you have a disc herniation. What should you do now? Well, if your symptoms are relatively mild, then you could probably get away with doing almost anything and start feeling better. And so if you're 1 or 2 out of pain, maybe having some glute pain, hamstring pain, you can do most of your daily life, then I would just say, hey, do some gentle strengthening, do your normal thing, and just go about your life. If you want to get a little bit more nuanced, then just get an evaluation from a PT or a physio, and they'll give you a couple things to work on. Like, it's that simple. Don't get overcomplicated, because if you really start at trying to improve things on an image and treat your body like a car, you're going to run up the cost, time, and it's going to be frustrating, and the outcomes are not going to be any better. In fact, people who pursue more treatment for their back pain are more likely to have surgery. So don't do that. If you have a herniation without sciatica and you're feeling relatively well, then don't do anything at all. Just don't change anything. Now, if things are a little bit more severe and you're having a herniation and a resulting to sciatica, what I would do, because of the nuances and just the difficulties in treatment, is that I would get an evaluation from a PT or physio, spend the hour of time just really learning your body and doing your thing, and I would download my free sciatica PDF. And that's going to go over some really good nuances that I tell my patients and things that we want to make sure that we understand as we are going through some strengthening and stretching and nerve mobility and just improving the system and improving how you feel at the same time. And so it's pretty nuanced. It's a long PDF. It's absolutely free because it is the information that you should know, and it gives you a good foundation to start building upon. And so utilize that PDF for what it's worth. Utilizing that PDF is going to give you a good head start for sciatica and disc herniations. It's going to give you both of those things. And so it's going to give you those nuances and those little tips and tricks and the clinical things that I tell my patients to help them be successful in treating both of those. And so the relationship between a disc herniation and sciatica, like, they're very intertwined. They can be completely related, and they can also be separate. And so what I've seen too many times is people really try to treat an image, and that's not the way to go. Don't go around trying to treat an image, be like, hey, like, I have a herniation at L5S1. I need to get this taken care of in order to feel better. That's not the case. You need to treat your body and treat the symptoms, and that's why we more than likely lean a little bit more towards the treatment of sciatica, because if people, when they have a herniation and they don't have sciatica, they don't really care. If they have a herniation and sciatica, then they really start caring. So we're really just treating both of them and utilize that PDF to its best of its capability, and it'll help you be more successful in your treatment. And so I hope you took something from today's video. Sciatica and disc herniations are highly related, but the treatment for them can be really connected. And so utilize that PDF and let me know what you think. Make sure you download it, go through it, and ask me any questions that you may have. But as always, stay healthy, keep moving, and take care of yourself.